We are going to start now. Thank you guys for joining in with us. I do appreciate it. Everyone should be currently muted at the moment. We're just going to start. We got a couple of people in the room. Thank everyone for joining us on this UCHAPS National HIV Testing Week debrief. How to host a successful testing event is what we'll be talking about and focusing on today. My name is Ronald Shannon. I am your moderator and the health impact specialist for UCHAPS. In case we have any guests on the line, UCHAPS is the Urban Coalition for HIV/AIDS Prevention Services, and we are a collaboration of community partners, health departments, dedicated to preventing new HIV infections and reducing health disparities. Right, we got a couple of housekeeping things to take part of here. All lines will be muted during the webinar. If you have any questions or comments throughout, you're more than welcome to submit them in the chat box. You should say Q&A box, or you can send me a direct email. I will also respond to those as well. We will have a live Q&A portion of the webinar at the end if you would like to save your questions for then. Just to give you a visual, there's the Q&A box there. Type in your questions. That one will actually show it to me directly. If you put it in the chat box, it's going to go to everyone in the panelists. And you can also have a side conversation there as well if you would like to continue on with the conversation amongst yourselves. On to our presenters for today. Very, very thankful and appreciative of everyone that we have speaking with us today. We've got a great group of presenters. First, Michelle Rollins, founder and director, We Think for Change. Omar Martinez Gonzalez, community outreach and testing coordinator for Cook County Health. We've got Veronica Jackson, which is the Deputy Director of Brotherhood, Inc. And we've got Sharon Corker, who is the Executive Director of SLK Health Corporation. So we are excited to present to you today, and we are going to jump right in. Let's see, we've got Veronica is actually going to go up first. Veronica, I'm going to hand you the controls, and I'm going to unmute you, and you can take it from there.
We're going to talk about some strategies that Brotherhood Incorporated has utilized to host testing events. We want to thank UCHAPS, as always. UCHAPS has been a viable partner in helping us to do that. We're going to talk about today some things that are integral for success. First of all, you have to have a desire to serve. You have to be passionate about the things that you do. There's a saying, of course, if you love what you do, you never have to work a day in your life. You have to have a laser sharp focus. You must have something in mind that you want to accomplish, and we'll talk about how to quantify that later. You have to be persistent about seeing to it that you get what it is you need to make your event successful, whatever that might be. You definitely want to think out the box and have ideas that will draw in your target population. You definitely must have a good team in order to have a successful event, and before, during, and after, there's going to be a push. You're going to be pushing constantly for your target demographic to come out and participate in your testing event. First thing is you want to be prepared. The key to anything in life is preparation. There's a saying, those who fail to plan to fail. The same is true for hosting a testing event. I used to teach years ago, and there was a slogan popular by Nike that said, just do it. Well, that definitely should not be applied to a testing campaign if you want it to be successful, because you want to have some assurances and some safeguards in place that you're going to actually reach your target audience. So you want to then strategize with your team. That's going to be first. The first key to preparation is getting with those persons who are going to be in charge of testing and developing a comprehensive strategy. What is the goal? How are we going to get there? Then you want to set some objectives for your target audience once you decide who they are. Who are the intended testers? Who are you looking to reach? Is it the MSM population? Is it IDU? Is it homeless? Is it transgender populations? Who exactly is your intended target? Then once you've decided who it is you're going to test, you definitely want to, if you have some jurisdiction over that, set your testing hours at a time conducive for your priority population to come out and test, because the testing hours will determine whether or not you in fact are able to reach that particular population at that time. You want to be as specific as possible. Set some realistic, tangible goals. How many persons are we looking to test? You want to set up matrix, because after your testing event is over, how will you know whether or not you were successful if you do not upfront set some matrix that will guide the testing? Then you want to develop a marketing campaign. You want to publicize your event, and that campaign needs to be tailor-made and specific to who you're looking to test. Then there's some considerations. How far in advance do you need to start that marketing campaign? Of course, that is going to determine what forms of marketing are you using. Are you using social media? Are you using radio? Are you using broadcast? Are you using TVs? What are those market strategies that are actually going to be utilized? And of course, what you use will always be considered by monetary constraints. You know, are you looking to do free marketing, free advertising, or do you have some funds at your discretion? If in fact you want to advertise radio or TV, there are many radio stations and TV stations that will publicize your event for you for free if it is for a healthy, for some health-related cause. I know during national HIV testing campaigns, Brotherhood has always successfully been able to capitalize on local radio stations, local TV outlets who in advance publicize the testing event for us. That serves two reasons, two purposes. It is able to get some additional name recognition for the agency, and it is also an excellent way to draw attention to your testing campaign and have people come out to actually avail themselves of that testing. You want to use attention-getting flyers. I picked this in particular because there is, I don't know where all of you guys are hailing from, but New Orleans is the home of Popeyes. L. Copeland, the founder of Popeyes, came from New Orleans. And right now there's a big debate between Chick-fil-A and Popeyes, which chicken sandwich is best. So when you're putting your campaign together to publicize, you want to use something attention-getting. I use that just for humor, but of course the staff puts together flyers for the actual event. We're having tonight, in fact, a back-to-school event that's being sponsored at a local MSM bar where we test. And for back-to-school, we test a lot of university students. So the flyers want to be attention-getting. They want to be eye-catching. You want to use a hook or a slogan, something people can remember. So that's why I use the little meme kind of that you see on the screen. I'm looking at you, Ronald. I don't know what happened. I don't know what happened to the presentation. Next, when you're looking for marketing strategies, we've also always found it helpful, as I said, thank you, to enlist the assistance of UCHAPS. UCHAPS has been a viable partner during our national HIV testing campaign. I have reached out to UCHAPS more than once. And can you guys still hear me? UCHAPS has been amazing with regard to providing us funds to draw out people for incentives. People like incentives. During the National HIV Testing Week, we always are fortunate here in New Orleans. That happens in conjunction, normally around the time that our Essence Musical Festival happens, one of the largest events kind of nationwide. And so it's always an excellent time to do publicized kinds of things that will draw out a crowd. What you see is some of my staff persons and the publicized incentive that we use, which was the raffling of a TV. That always draws a crowd. We also were able to, the agency donated, we did have some funds where the agency actually donated. This is one of my Walgreens stores, but at the other store, the agency was able to raffle off Essence tickets. And so at both places, we had a phenomenal crowd. One thing you might want to consider is local celebrities. Local celebrities help. The person that you see, that's me with my cute self. The person that you see sitting with me is a local radio personality, Wild Wayne of Q93. He is very well known in the community. And what we always do during testing event is a live radio broadcast. People come for the Essence tickets, but in order to get those Essence tickets, of course, they must be tested. People might show up for a chance to win the TVs, but in exchange for that opportunity, of course, they must be tested. So don't be afraid to use whatever local resources you have, such as a radio personality, somebody who is a gatekeeper in the community, a civic leader, anyone that you can enlist their assistance for a draw. Social networking. We live in a media savage, technology rich age. Recruit key stakeholders that come out to your event to actually publicize the event for you while you're actually testing. Persons who have large Facebook followings, large number of persons who follow them on Instagram. Get them to do live tweets while your testing event is going on. They are phenomenal at spreading the word for you before and during the event, because social networks, people with social networks have persons in their network who also have a network. So they will definitely help you to publicize. What you see is a testing event. That's my staff with the Halloween garb on. We did a testing event during October, so we capitalized on Halloween. And while persons were there, of course, there was a shaky booty contest and all of those things, but in order to participate, people had to be tested. Very important. You definitely want to familiarize yourself with the testing space in advance of the event for a variety of reasons. Number one, you want to make sure it's HIPAA compliant. You want to make sure that the space is adequate. You definitely want to consider things as privacy, how the client flow is going to go. We tested one year at a store, and we did not necessarily have buy-in from the manager, and the place where he was going to put us was essentially in the aisle. Well, that's not conducive to testing, because you have clients who might want to test, but don't want to stand up and fill out paperwork, don't want other people to see them as testers. So you definitely want to go and familiarize yourself with the space beforehand. You want to introduce yourselves to those persons who are going to be hosting the event, so that in advance, you can troubleshoot any potential problems that might arise. Very important. You want to have buy-in from the location where you're testing. For that day, they are your team members. Wherever you are testing, the managers, the nursing staff, wherever it is, make them an active partner. If you make them feel that they're involved, they will assist you in ensuring that your event is a success. This is actually one of the store managers for a store that Brotherhood has been testing at for the last 7 years. He is our biggest mouthpiece with regard to ensuring that we're testing. He announces that we're testing in the rear of the store. Whenever we go in, he provides as many spaces as we think we will need to reach our projected target. We normally test for him both mobily outside, and he provides, if you see partitions and where the bathrooms and stuff are, we actually put up partitions to do additional spaces. So if you make them feel a part of the team, the persons who work there will do what they need to do to ensure that you are successful. The day of testing. You want to arrive early. You definitely want to run your controls. If your event is supposed to start for 1, you can't arrive at 12:30, because you want to make sure that everything is in place and ready to go at the appointed time of testing, so that there won't be any hiccups. So you want to get there early. Then you want to ensure that you have a place for your incentives. You want your space to be appealing, and you've already pre-negotiated that with the managers, the nurses, the church staff, wherever it is you're testing. You already have negotiated what you need, the tabling, the chairs. So you want to arrive early so that you can make a display that is appealing, and again, so that you can circumvent any potential problems that might arise. You want to make sure that you have marketing materials. If you're going to have on hand condoms, safe sex kits, prep information, information about your agency, your organization, all of that needs to be arranged, and of course your incentives. All of that needs to be arranged in advance to set the tone for testing. So now you've done all this planning. You want to have a plan already in advance for your staff. If you have more than 2 testers, you see me and some of my staff members at an actual Walgreens testing event. The person who is not in the shirt actually came from our local health department, just to make sure everything was going well. You should have pre-assigned staff roles. Before you get there, everyone needs to know exactly what it is they're required to do and at what times. And because my staff is relatively small, I do it on a rotational basis. So I might have 2 persons start off as testers. I might have 2 persons outside the store recruiting people. And then of course I have people sitting, actually doing intake and assisting persons with the paperwork. You want to do all of that in advance to ensure that you're reaching your demographic. And then hold true to what has been marketed. Whatever you've said on those radio spots, whatever you put on those flyers, if you're saying you're going to have incentives, make sure you have them. This again is another TV that we raffled off by the philanthropic efforts of UCHAPS, and we're extremely grateful. And that is the winner of one of those TVs. You see behind him, we have our prep table and 2 of my staff members. So if you have the discretion to have some incentives, make sure you have them at that giveaway, because the last thing you want is things to have gone out publicized and then you don't deliver what it is you've promised. But incentives do help. Finally, now you're ready. You have your goal, you have your rubrics, your metrics of how many people you're going to test. Begin your testing event. And depending on how many you've projected, that will determine, how many testing spaces you might need to utilize. In our case, that means we need to provide mobile testing and in-house. And the reason why that's always been the case for us is because I said we try to use radio personalities who are doing a live broadcast. That may or may not be at your discretion, but if you can do it, go for it. I have all of my staff, while they're testing in between, tweeting and posting on all of the agencies' social media pages. Some of them post on their personal pages, their Facebook, their Instagram, getting their constituents to come out and test, talking about the giveaways, the impetus for testing, giving some national, local, regional statistics. All of that is a draw during your testing event. And as always, very important, make the appropriate referrals. We have, during testing events, had persons who were HIV positive. Take that time to start your linkage to care immediately. Take that time if you come across someone who is homeless or has mental health issues or whatever the case may be, take that time also to make those appropriate referrals during testing, and of course, give out your incentives that we've talked about. Have appealing table displays. My staff thinks you're cute, they're cute, as you can tell from the poses, but have table displays, have an info table with relevant information, because you want the persons to get the entire testing experience. That is your chance, and aside from testing them, to talk about the various programs that your agency has to offer. So have appealing table displays with relevant information. After the event, you've already set your metrics in terms of what you wanted to accomplish. When the testing is over, quantify your success based upon the projections that you made before the event happened. If you have sponsors such as UCHAPS, your local health department, or whomever, report back with specific feedbacks about what went well, what could have been approved, any commendations or recommendations as might be appropriate. And as always, of course, those who test positively, you want to do your follow-up for linkage to care. No, you can't leave the testing event to actually have them access care, but conduct your follow-up. And what you see at the bottom is while Wayne, and you see the store manager, Mr. Medina, raffling, picking out the winners of those Essence tickets that we talked about earlier for our staff. And then tout your success. Who you see, those 3 persons with shirts on are staff members of Brotherhood, but they all sit on a advisory panel for our LGBTQ commission from our mayor's office. And so when your staff does a phenomenal job in testing, use that time to tout your success. Talk about the great work that you're doing in and around the community, because together, of course, we can stop the epidemic. Thank you. And that's it, I'm done. Veronica's done, Ronald, did you hear me?
All right. Thank you, Veronica. I appreciate that. Sorry, I was unmuting myself. I definitely appreciate that. We appreciate all of the good tips and feedback that you gave us from your testing event. Next, we have Omar Martinez Gonzalez from the Cook County Health, and he is going to go up next. I'm going to, Omar, you can unmute yourself and just tell me next, and I'll go ahead and control the slides for you.
All right, thank you so much, Ronald. And actually, I'm on the laptop, so I can probably.
Okay, let me give you the controls now. 1 second. All right, there you go.
All right, fantastic. Hello, everyone. Again, my name is Omar Martinez Gonzalez, and I am the Community Outreach and Testing Coordinator at Cook County Health, based out of the Ruth M. Rossing Core Center. And today I'm going to be sharing some insight into the efforts that we implemented for National HIV Testing Day here in Chicago on June 27, 2019. It's not going to the next slide.
You see a link that says take controls?
It just says you can control. Well, I still don't see my presentation.
Yep, just click next and it should advance forward for you.
Okay, I see the previous presentation up right now.
You see yours now?
No.
Odd. 1 second.
Sure.
We see the new
I see my
presentation.
presentation.
All right, perfect. I'm going to give you controls right now.
Okay.
There you go.
Perfect. All right, so
Okay. There you go.
all right, so for today, my objective is to provide some background information on the Ruth M. Ralston Core Center, to summarize the logistics and outcomes for National HIV Testing Day for us, to discuss the tools and partnerships that made our outreach efforts a success, and finally, to identify potential areas for improvement. So to start things off, I want to provide some background information on the Ruth M. Ralston Core Center, which is one of 18 clinical sites through Cook County Health. It opened in the fall of 1998 and has served as the largest one-stop facility in the Midwest for the prevention, care, and research of infectious disease. We see over 10,000 patients annually for HIV/AIDS care, as well as the treatment of other infectious diseases, including hepatitis C. We have just under 5,000 active HIV patients, 75% of which are, what happened? It went to the next slide. All right, 75% of which are uninsured or covered by Medicaid. And we have just under 100 newly diagnosed HIV patients every clinic per year. So to summarize what we did for National HIV Testing Day, we partnered with Walgreens and the Cook County Department of Public Health for outreach and marketing of the events. We disseminated flyers to surrounding businesses where we were testing, and we posted on social media through our social media accounts. This year, we tested at 3 locations throughout Cook County. One of them was the Ruth M. Ralston Core Center, which is located on the west side of Chicago. The other 2 sites were Walgreens sites, one located on the south side, the other one in North Lake, Illinois, which is a west suburb of Chicago. We activated a total of 21 staffers and volunteers across all 3 sites and conducted a total of 71 Aura Quick Rapid HIV tests. At Core Center, we did 23 tests. We had no positives. At the south side Walgreens location, we did 14 tests. We had 0 positives. And at the Walgreens location in North Lake, Illinois, we tested 34 people, and we found 2 positives. By connecting them with partner services, we were also able to identify an additional partner that tested positive for HIV. So in total, we found 3 new positives that were linked to care at the Core Center. And of those 3, 2 were co-infected with syphilis. So to promote our testing events, we posted digital flyers on social media. Again, we disseminated printed flyers at venues located around our testing locations. And the events were promoted through the UCHAPS and greaterthan.org online platforms. So greaterthan.org is a program through Walgreens to promote HIV awareness and testing. So we capitalized on those two sites to really promote the events. Here you see a screenshot of one of our, the front page of our flyer. We provided clear information about when we were testing, what services we were providing, as well as the partners that made the testing event possible. On the back end, you have the locations, the timeframes, a list of sponsors, included my contact information. We thought it would be important for people to be able to reach out to us with any questions or concerns prior to the event in case they wanted to address something before they went in. And then it's been mentioned before, leveraging social media, super important. So we posted digital flyers on the Cook County Department of Public Health and Core Center social media pages. Those two posts that we made had over 400 views between the two sites and was shared 16 times. The Core Center also issued a press statement the day of to promote the testing efforts. So here you have a screenshot of the post that was posted by the Department of Public Health. And this is the post that we made through the Core Center. As you can see, whenever you do social media outreach, you want to tag the different sponsors or partners that you're working with. So we did that. That kind of increases visibility beyond the network within your social media network. And the 400 views that I'm reporting is just between those two posts. It doesn't include the views that were accrued through the 16 shares. So we estimate that it was a lot larger, the outreach. We also leverage partnerships. We worked with Walgreens in the past, so we decided to reach out to them again to see how we could collaborate during NHTW. They provided access to testing rooms at no charge, provided marketing and handout materials like banners, balloons, buttons, things that we could give out to participants. They provided us with marketing for the events through their website. We Are Greater Than AIDS campaign online platform. We provided free bottled water for the staff, volunteers, and clients at the two Walgreens locations. For us here in Chicago, June 27th was a really hot day, so that was an invaluable resource for us to be able to make sure that we were taking care of our people. And they also have provided an opportunity to continue to do testing at their locations moving forward. Here in the picture, you see the banners that they provided us with. They had sidewalk stands promoting the testing that is happening inside, so people would know coming in that the service was available. And they gave us premium space right by the pharmacy for us to set up our tables and have quick access to the private testing room so we can engage people and kind of, move them towards the testing area as quickly and efficiently as possible. As I mentioned again, we worked with the Department of Public Health here in Cook County, and they were an invaluable resource in providing intelligence on HIV incidence stats on the West Suburbs, something that we didn't have access to. They provided educational materials for tabling, access to condoms and lubricant. They provided us with staff that assisted us with outreach the entire day, so that was also invaluable. And they have offered to continue working with us on HIV outreach and screening on the West Suburbs. Something that I want to mention about that partnership in particular, they were heavily pushing for us to go test on the West Suburbs. That's not an area that we normally go to test, and that's actually where we found our positives. And so it was really that intelligence that really informed our outreach effort. And we're going to be able to continue to go to those locations to provide that service that's much needed.
Respect to 888-1866.
So somebody's not muted. All right. So in regards to the UCHAPS sponsorship that we received, the funds really went towards the purchase of food. I know the slide says 10, but we were actually able to purchase 11 sandwich trays, each containing 15 subs, and the Subway that we worked with donated one extra tray. We were able to negotiate with them on how to lower the price, so they gave us the trays, which were normally priced at $40 at $32, so we were really able to maximize the funds that we received. Food was a huge incentive for people to stop at our table to test, so that was a wonderful thing to have. We were able to buy bottles of water, again, for the staff and volunteers, ice to keep everybody cool, chips and snacks for the clients, and just materials that we needed to be able to put up banners and stuff like that. So the UCHAPS funding came in, was a huge help to us. So to discuss some opportunities for improvement, we began our planning process about a month and a half in advance, and we found that that was not nearly enough time to be able to really implement our initiatives the way we wanted to. There were some hiccups here and there. Walgreens had to switch the site where we were testing a couple of times, and so that kind of threw a wrench in our plans, but we feel that if we are able to plan at least 2 months in advance, we'll be able to avoid those types of hiccups. We also want to engage and sustain social media outreach. At the time, we were going through internal changes in our staff, and that prevented us from really being able to do a lot of media outreach. But hopefully for next year, we're going to implement a plan to really engage people consistently leading up to the event and through the event. Social media is particularly important for younger generations, and so we see the value in that as well. We also want to engage more community organizations and institutions. We primarily worked with the Department of Public Health and Walgreens as our partners, but we really want to leverage the community organizations that are surrounding the testing locations where we're at, not only to increase outreach and impact, but also to have an opportunity for us to create relationships with them for future testing. We're also working on implementing INSTI, which is a faster testing technology. Currently, we're using OraQuake, and that takes about 20 minutes to resolve for your result. And so we found that there were some people who didn't want to wait or couldn't wait. And so by implementing INSTI, we're hoping to increase our impact and the number of people we can test. And then finally, we want to see how we can allocate some of the funding that we received towards t-shirts and tote bags. So again, most of our funding went towards food. And then at the end of the day, we had about we still have just 10 people, but if we can maybe move some of that money towards other incentives like branded t-shirts or tote bags, I think that'll create more impact. We could do a youth t-shirt. I know that those are really popular in the community setting. And finally, I just want to acknowledge the people that really made this event possible. Ronald Shannon over at UCHAPS for reaching out to us to inform us about this opportunity for funding and for supporting us throughout the entire process. Allison Precht, our director here at the Prevention and Education Department Core Center. Her work on this was invaluable. Anna Galarza and Alfredo Delgado, who are 2 staffers here at Core Center. Stacy Ravanesi, who is our contact over at CCDPA. And Scott Divney, who is our contact at Walgreens for helping support us in securing those locations. So with that, I want to conclude my presentation, and I welcome any questions you may have.
Awesome. Thank you, Omar. I really appreciate you giving that feedback. And I must say that I was there that was my site visit, was Cook County. And so I was able to be at one of the Walgreens sites, which was amazing. You have an amazing staff. I had an awesome, great time. And if I'm ever able to do this again, I definitely would love to come back out there and visit you guys again. So we are going to go on and continue to conclude with our roundtable discussion portion of this of the webinar. And so my panelists are ready. I have some questions that I'm going to be asking you guys just so that we can dive a little bit deeper into the testing event. If you have any questions, you are definitely more than welcome to shoot me a question and answer, and I will direct it to whomever. If you have anything you want to add, if anybody's online that want to add anything, you're more than welcome to do that as well. So my first question, I'm actually going to go over to Sharon and ask, how did you begin your process for planning your event? I got you unmuted now, Sharon.
No problem. No problem. I'll bring it.
Sharon.
Am I good now?
Okay, yep, yeah,
Okay,
you're unmuted.
fine. Good afternoon, everyone. I'm Sharon Coker with SLK Health Services Corporation. And our process began, I would say, maybe 2 months out. We're a fairly new operation. We began our doors open back in October. So we're about 9-10 months in to being a community-based organization. So we were looking for anything and anyone who could help us to promote this day. We've all worked previously in other positions in other organizations, and so June 27th is an important day for us. And more importantly for me, that's my birthday. So with the help of UCHAPS last year, we were able to get funding again this year. And so we plan to go back to an area where most of the people in that community know our faces, and we've built relationships with that community. So it's not just we actually were at a Bell's liquor store that's bordering DC and Prince George's County, of which we reside, but also we reached out to the police department. We reached out to the city mayor because we wanted this to be a community effort to show the community persons we're targeting that we're here to help you. So we started that process about 2 months out, and with the financial assistance with UCHAPS, being a new organization, we didn't have a mobile unit, so we went old school. We bought a tent, and we bought tables and chairs, and we had a cookout, a picnic, and that was incentive to get people in our space. But one thing that made us happy was the Bell's Liquor Store were kind of like, you know what, we're not really prepared this year. We've got to cut grass, and we say, hey, no worries. We actually cut grass before going out there. And because we went beyond just the norm to say, hey, we need a space, we're like, what can we do to help you in this effort? And he says, I need lawn service. We were able to go out there, clean up the lawn area, up the parking lot. And because we were doing more than what we asked of him, just that time and area, they were all in. So you really have to get that buy-in with the community. And so it kind of fell into place. So with the money, we're able to buy things. We had volunteers. We're big on have people give back. And I would think our one thing we didn't plan on, it was so many people in the community saying, hey, we are glad that you came to speak to us. We're glad you met us where we are. We're glad you didn't look down on us. And so I would say next year, I would probably plan for more volunteers because as a new organization, we have a very small staff, but I'm being prayerful that moving forward, we'll have enough staff to be available on hand to accommodate if the crowd were to double next year.
Awesome. Thank you, Sharon. Thank you for that. Also, I want to pose the same question to Michelle. I'm going to unmute you now as well. When you are, and I'm asking you this question because we do have several different demographics on here. We've got Ohio, we got Cook County, which is in Illinois, Louisiana, and Upper Marlboro, Maryland. So, Michelle, how did you guys go about starting and planning your event? I'm actually going to put your flyer up as you talk.
Okay, I'm Michelle Jackson Rollins. What we think for a change, and also Garden Valley Neighborhood House as a volunteer. And we received we had been wanting Hydea to come to Ohio, but just didn't know how we were going to get her there. And so when we received the email for UCHAP to apply for funding, we said, oh, this is a perfect time to do testing and to bring Hydea. And so we had, we started out with doing the, looking at the surveillance numbers and the red hot areas that were on the map for our testing site. Garden Valley also, we serve it, we feed 15,000 people a month, and we also have testing there. So this was going to be a perfect time to bring Hydea and to have testing. We also had a festival that was going on the following weekend. So we were able to promote the event at the test site, at the festival as well. So with the, with UCHAP, thanks so much for UCHAP. The amount of money that we received from them was a seed, and then we were able to leverage all the other partners to come aboard and to bring Hydea. As you all know, Hydea is a international HIV/AIDS activist. An ambassador. She's also AIDS ambassador who was diagnosed at the age of 3. And so when she came in, we had 3 events. The first event was at the Metro Health hospital for positive population. And so she came in, and the response that we received there was phenomenal. We had people that came out that had not been out, and they opened up. They were able to tell their story, their trauma, their fears. They start sharing their narratives. And afterwards, they wanted to get involved in testing from here on out, and wanted to see how they can get involved in doing whatever we were doing. And then we also had testing that same day at Garden Valley. Then we had Wednesday, we had the luncheon with the seniors at Garden Valley Neighborhood House. And our seniors are they're well educated on HIV, and they're our biggest advocates in our community. So when Hydea came, that really just put them at a whole different level of their advocating and encouraging people in our community to get tested. And we also had testing that day. And then on Thursday was our major event. We had National Testing Day. The AIDS Collaborative did our testing. They also gave out T-shirts and giveaways. We ran out of test kits. 95% of the people that showed up that day were tested. Then that evening, and then we also had an educational session where we talked about breaking barriers, reducing stigma, and increasing awareness, and PrEP and PEP, criminalization. So we were able to do a lot on the actual the day of the National HIV Testing Day. And then that evening we had Hydea at the Word Church. And keep in mind that this is our first time ever having an event at a mega church. And also this was a location where we have some of the highest new diagnosis and STD diagnosis. Okay. So, and everyone that came there was new. We saw a whole new faces, and people came from all over the state of Ohio, from Columbus, from Youngstown. We had people from different areas in Cleveland who had never been in this environment and were able to get a lot of education. The audience was very engaged, and so it was a very successful event. And I would say that our number one best practices was leveraging and partnership, because it costs a lot of money for us to get her there. And UCHAPS gave us the seed to get started.
Awesome. Thank you so much, Michelle. We really appreciate that. And that probably is a good segue into the next question that I received from one of our guests online, who asked, what are some of the and anyone can answer this question if you have anything to add into, what are some of the non-HIV LGBTQ community partners that you've been successful with in partnering? And any one of our panelists can actually answer that question if you have anything.
I'm sorry, Ronald, can you repeat the question?
Sure, yep. What are some of the non-HIV LGBTQ community partners that you've been successful in partnering with?
Sure. Brotherhood actually has a variety. There's a local facility called TSAP, which stands for the Total Sentencing Alternatives Program. It is a program for persons not from a particular demographic, well, then yes and no, but who have recently been released from incarceration. They've provided us phenomenal assistance anytime we've had a testing event, by way of publicizing the event for us, to send their clients to come out for testing, not just in-house, but at any event where we are, because we give non-monetary incentives as well as monetary incentives. So that has worked well for us always. We also have received a lot of support actually from our healthcare organizations in and around the city. There's a plethora of community-based organizations that we have MOUs with, all of which are not LGBT. They have been our biggest mouthpieces with regard to getting the words out for their constituents. Even though social media is amazing, there's also something to be said for old-fashioned word of mouth. And those partners with whom we've worked closely, who do not work with a particular demographic, they've always been very vital and very instrumental in publicizing events for us, and that has worked very, very well. On the numbers, I did not present our numbers for this year, but we did test a total of 123 people this year for our national HIV testing event, and I have a staff of only 8 testers. So I think that is phenomenal.
Yes, that definitely was amazing. We appreciate that feedback that you gave. I did hear some feedback about the issues with the testing events. I mean, the testing kits. Is there, and Omar shared that they were more so going towards the INSTI. So is that a consensus from everybody online?
Yes, definitely.
Okay.
Definitely.
Awesome. Okay, I will definitely get that feedback and take that back to UCHAPS.
And Ronald, I also like to be, this is Sharon. I also say we, SLK gets a lot of support from churches. One in particular, Reed Temple out of Glendale, they give a lot of financial support in our efforts to incentivize a lot of testing, because a lot of times people want, what do you have for me to get my attention?
Right.
And it helps. It truly helps us a lot. And the local police departments, they're very helpful, because they sometimes can point out where you need to be and also provide security as they're doing their rounds.
Exactly. Yeah, thank you for that too. That is definitely important information that we need to include while we're doing our testing events as well. Let's see, another question I definitely wanted to make sure that we can, can each of you just give us 2 of your best practices for organizing a testing event to someone that may be new online that's organizing testing events?
This is Veronica. I think one of the best practices that this agency utilizes, since I do hire the particular demographic that is our priority population, which is MSM and transgender, one of the best things that we use as a strategy is that we use the relationships. Leveraging relationships is very key. And we use the relationship that we have with local MSM bars, clubs, etc., where our priority population tends to hang out. And sometimes as far as 6 weeks out, during their most popular nights, they will begin announcing for us free of charge, since we have a collaborative relationship with them, that we're about to host a testing event and encouraging people to come out to test for us. So there's definitely something to be said about leveraging the relationships of partners that you already have. They, in addition to social media, will definitely help to publicize your event and make it a successful event for you.
Awesome. Anyone else have any best practices?
Sure, this is Omar. And this was actually already mentioned in the first presentation, but I just want to echo, visiting the site that you're going to be testing at is super important, just so that you have an understanding of the layout. You can kind of plan ahead if you need to bring anything additional, like lighting can be a real issue, especially in outside events. And fostering those relationships with the people that are going to be staffing the event with you, that are part of that organization or location. Not only to help you during the event, but in future events, if you want to go back to those locations to test again, it's really important to foster those relationships. And also, when you're coordinating your staff, making sure that you take staff to a location that's comfortable with the location, the environment. Say if you're going to, so we went to North Lake, Illinois. That's a highly Latino population over there. So we had people that could speak Spanish. So making sure that, you know, you cater your staff according to the demographics of where you're testing.
Awesome, thank you. And the lines are open as well for questions. I just want to jump that into you guys. We'll end around about 3. I just want, if you guys have any questions, please definitely send them my way while they're continue to answer their questions as well.
And this, I'm sorry, this is Sharon. Also, when you're working with volunteers, it's important that you give them training because each event has a different feel, a different vibe for it. Let them know what populations you're targeting. So if they're not comfortable, maybe they need not be so much hands-on as a supportive person. That makes a difference because, again, you're targeting, you're testing, and people will sense your anxiety as opposed to your welcoming smile.
Right.
And so that's very important that you make sure the volunteers that you have on board for that particular event really knows what you're doing, who you're touching that day. So they're comfortable with what they're wanting to do because they want to give their best efforts.
Right. Thank you, Sharon.
This is Michelle. I was going to talk about the some of the best practices also, planning early, at least 6 months in advance, and leveraging and being very persistent, utilizing all your community partners, and also meaningful people, the MIPA involvement, because they're the best people with the experience and peers, and they just always are real educated on all this, and it's good to get them involved as well.
Awesome.
And this is Veronica. One more best practice. It's a best practice out of experience, to be sure. We tested one year at a store that actually wanted another group to test. And even though I had done my due diligence as the deputy director and the director of prevention services to go multiple times to that particular site, to introduce myself and, encourage them to participate, the manager was never available. And so the day of testing, I found my staff testing in less than ideal situations until I got there, of course, and rearranged the store. I'm kind of like that. Because I did make it happen.
Right.
And we still had numbers through the roof. But it is very important that you go and assess ahead of time so that you can troubleshoot just that. You want to make sure that you're able to be successful. And again, having the persons who you're testing have buy-in, that's critical and crucial to your success. Because if you're in a situation that for whatever reason, that there's not buy-in on the part of the persons who have to help you facilitate that, you will not be as successful as you should be.
Awesome. Thank you for that as well. We do have a question that came in that I definitely want to get answered. Let me see, go back over to my question. Sorry about that. I just had it up. Let me see. Question about the your any positives. Did any of your events have any positives that they found that day besides Omar? They had a plethora of positives that you weren't necessarily thinking about, that the demographic that you were at. Were there any surprises in the amount of positives or the amount of negatives, et cetera, that you got?
Well, this is Veronica again for Brotherhood. This particular year, no, there were no surprises, but we did have a year where we did kind of have a little entertainment for a discordant couple.
Okay.
Gentleman had come in and tested previously and had to bring in his spouse, as it were. So you kind of want to also plan for that as well, because you just never know what you're going to encounter at a testing situation. So while it was not a surprise, luckily quick thinking prevailed and we were able to contain what could have been a contentious situation just because the couple was discordant.
Gotcha. Thank you. That was good information as well.
And then I know, this is Omar, by the way. I know that I previously reported the numbers for our testing locations. We were just surprised at the fact that we had 2 positives in North Lake, Illinois, within 20 minutes or so of each other. They were not related. And we were able to find additional clusters of positives. And so that's one of the things that's going to inform how we move forward in testing in that location. We want to expand our outreach in that area. And I mentioned that we wanted to create more resources. At that location, we didn't have a resource guide for people that wanted to be linked to PrEP in that location. Specifically, we had linkage opportunities for our clinic. But we want to develop that tool because that's so important. That location is kind of far from the city itself, from where we're located. And so we want to definitely be patient-centered and make sure that they are linked to care, even if we can't help them out in our clinics ourselves.
And this is Veronica again. On the reverse side of that coin, this particular year during our National HIV Testing Week, we partnered with a new partner and we were able to do something novel, I think that was unique, that kind of set us kind of apart from the other HIV/AIDS service organizations that were testing. And that was, in addition to, the HIV and STI testing, we actually were able to get a local physician to come out during a testing event with us at one of the stores where we tested, and he was able to, on hand, talk to persons who were interested in PrEP. And the response was phenomenal. So you want to have something definitely in place for your HIV positive persons, but you have a lot of high risk negatives that need some information as well. And it was very helpful to have an MD who could actually write a PrEP prescription on the spot for those persons. And so that worked extremely well.
Yes, that's amazing. And I that was a good call and good look for you guys to have that on hand. I want to respect everybody's time. I do have one question I do want to pose to the group because that I do want to cover, because we are living in a social media marketing age. I just want to know, did any of you guys, well, one, what platform did you find most helpful? And two, did you guys use any of the targeting marketing features on those platforms?
This is Sharon.
Mm-hmm.
We used Instagram, and we kind of did like a blow by blow as we were there. We had several people to call back to the office and say, hey, can we come and get tested? We don't want to be in public because we don't want to be in that location. And so because we were sharing information, what demographics has the highest rate, we got a lot of first-time testers.
Okay.
And they're like, you all make it so comfortable to talk about it. So if we could talk comfortably, maybe we should go get tested. Since we're the target population, maybe we should come in. So Instagram, Facebook, definitely for the millennials and Generation X, they were the biggest draw from our social media campaign with those two. Instagram, yeah.
Awesome.
This is Michelle. We leverage with other partners and people with social media and support.
Okay. Did you guys use Facebook or Instagram, or was everyone? Okay. Cool.
Yes.
Perfect. Yeah, that social media is definitely the way. As you guys, anybody, like you said, Veronica, with the Popeye's chicken went crazy. So, and that was partly, a lot of the numbers that I was reading was partly due to the social media
That's right.
they had. So that's definitely something good that you guys, that we can take away from the testing event. And was anybody else have anything to say? I didn't want to cut anybody off.
Sure. So this is Omar. Again, so we were able to use Facebook. That's really what we were limited to. Next, we want to be able to use Instagram. Snapchat is another great, social media feature that you can use.
Okay.
I know that there was a question on there about paid advertisement.
Yes.
Unfortunately, because we are a government entity, we don't have a budget for that.
Gotcha.
But through fundraising that we want to do, we plan on implementing something like that, where we're going to be able to take out ads on Snapchat and Facebook, and even some of the relationship ads, like or apps, I should say,
Right.
like Grindr and Tinder. Those are also great outreach tools that you can use. Amazing. I really appreciate you guys. I want to definitely be respectful for everyone's time. We said 3:00. And so there will be a brief survey that's going to pop up at the end. If you could take just 30 seconds to fill out that survey so we can get some feedback from this webinar. If you have any questions, concerns, anything we did not address today that you would like addressed, please shoot me an email, ronald@uchaps.org. I will definitely get those questions answered for you. And a copy of this will be online and up shortly for you guys to view and share as a resource. I really appreciate you guys. Thank you so much. And you guys enjoy the rest of your day.
You too, Ronald.